Hello, I'm Dr. Eric Goulder. I'm a board-certified cardiologist, and I practice at the Heart Attack and Stroke Prevention Center of Central Ohio. And I wanted to share with you why I left the traditional standard of care type practice where I had practiced for 30 or 35 years. The story actually goes back to when I very first started in practice some 30 to 35 years ago. I was on call for the emergency room. A young man came in with a heart attack. He was only 40 or 45 years old. He'd been playing racquetball when he developed this heart attack. And he had none of the standard risk factors for coronary disease that we all know about. No high blood pressure, cholesterol problems, was not diabetic, not a smoker. These are the days back before balloon angioplasty, before stents. Back then, in those days, it was considered dangerous to do a heart catheterization on somebody right away. It was considered dangerous to take somebody off to surgery right away. So what happened with these patients is they got put in the coronary care unit and they were watched. We supported all their vital signs and hopefully they made it through. Well, this young man did not. He proceeded to expire over the next 36 hours or so. And it bothered me tremendously, not only because a gentleman lost his life, but also because I had just finished my training. I felt like I knew lots and lots about cardiology, and yet I couldn't understand why this gentleman had a heart attack. So at that point, I knew that there was some big thing that we were missing about what causes heart attacks. Now, fortunately, because of research, especially over the past 20 years or so, we know that that big missing item is inflammation. But it wasn't until my wife, Dr. Barbara McClatchy, who's a dentist, went to a dental meeting and heard doctors Brad Bale and Amy Deneen talking about inflammation and how to treat that problem that the little light bulb went off in my head. And I actually thought back to this gentleman back in the early 1980s who died from this heart attack. And said that, okay, we now understand inflammation causes the problem, but standard of care medicine understands that too, but they don't know how to treat it. And doctors Bale and Deneen showed us their method of treating all this so that we can get the inflammation to settle down and thereby prevent further heart attacks and strokes. So that revelation that we can actually treat the inflammation that drives the whole arterial disease process, along with the fact that I was really getting tired of being that hamster on the wheel in the standard of care practice where I was seeing a new patient every 10 to 15 minutes, really not having time to talk with the patients and get to know them well, and certainly not having time to instruct them on changes they can make to their lifestyle that would help prevent them from having further troubles with arterial disease. So with both those factors in place, I decided that I needed to make a change and switch to a preventive concierge type practice. So now I have time to spend with my patients. I get to know my patients. We talk a lot about how they can play a significant role in preventing themselves from developing more problems with their coronary disease. And I now feel like I can give those patients that personalized care that I think they deserve in order to prevent them from having further problems.